Hi everyone. So in the previous lecture we started with enamel and we completed rods in this section of structures of enamel. Now today we'll continue with the incremental lines of Retzius. Okay. So what are the incremental lines of Retzius? They represent an incremental pattern of enamel deposition. What that means is uh, le- so let's just see first over here. They appear as brownish bands in the ground section and they show incremental pattern of enamel deposition. What does an incremental pattern mean that? Okay, so the enamel will be deposited, there will be one active period and then there will be a period of rest and then there will be another active period. Okay, so if I have, let's just say that this dark blue line, it represents a very active period of enamel deposition. And then I have this light blue line. Okay, so this will show like a slightly inactive period. And then I have a very dark blue line. So this is called incremental period of and this is called incremental pattern of enamel deposition. In the longitudinal section, um, this incremental uh, lines of Retizus, they surround the dentine tip. Okay, so they appear this circular in the longitudinal section around the dentine tip. They run obliquely in the cervical part. So they run like this in the cervical part. Okay. In transverse section, they appear as concentric rings as well. So in the transverse section, you'll see over here, if I cut a tooth from here, they appear as concentric rings. Alright. Along with incremental deposition, they also show variation in the structures and mineralization that occurs during enamel growth. What it means is that in the active, this dark blue active phase, right, the enamel will have a different consistency. So it might be more mineralized than this light blue and in the resting phase. In the resting phase, enamel is still being formed, but maybe it's less mineralized or it will have a different consistency. Okay, the daily mean rate of enamel formation is 3.5 microns. So this is the how much enamel form is formed daily. It is greater in the outer and the incisor and cuspal region. So the in the outer region and the incisor region, maybe the enamel that is formed, it is formed faster. Okay, evenly spaced try of Retzius represents 6 to 11 day rhythm. So this, these gaps you see in here. So every gap, every band, this band, it represents a period of 6 to 11 days. Okay. Metabolic disturbances may cause prolonged rest periods, which bring the lines close together, and therefore it broadens the line, making it more prominent. So, what will happen if I have a metabolic disturbances? Okay, a disturbance. So, this resting period will be prolonged, and if it is prolonged, what will happen is that uh, in let's just say that this thing took 6 days to form. Okay, so now in 6 days, only a small amount of this enamel will be formed, very small amount. So if a small amount of enamel is formed, these two lines, the dark blue line, it will come close together. Okay, so these lines will broaden and this resting phase will increase and there won't be so much enamel formed. So this will appear broadened and this will appear reduced. Okay, so it broadens the line, making it more prominent. All right. Now moving on to the surface structures of enamel. What are surface structures? These are the structures present, microscopic structures present on the outer enamel. So if I took a tooth and I looked at it using a microscope, I'll see these structures. So what is the first structure? First structure is prismless enamel. What is prismless enamel? So normally the enamel is arranged like the rods are arranged regularly, okay? But in the prismless enamel, this area, the rods are very haphazardly arranged, okay? So this is called prismless enamel. It is approximately 30 micrometers thick and it is generally present in the cervical region. It is present in 70% of permanent teeth and all deciduous teeth, okay? And the hydroxyapatite crystals are parallel to each other and perpendicular to the striae of Retizus. So this is the regular way of arrangement of hydroxyapatite crystals. that if this is the striae of Retizus, they will be perpendicular to the striae and parallel to each other. Okay, it is a heavily mineralized structure, heavily mineralized compared to the other enamel that is on the tooth. Okay. Other surface structures that are present on newly erupted tooth. So this is present in all tooth, okay, in the permanent in the deciduous. But and perikymata, rod ends, and cracks. These are the other surface structures that are present on newly erupted teeth. Okay, moving on. Uh, just a second. Moving on to the surface structures, perikymata. What are perikymata? They are external manifestations of striae of Retzius. What that means is that I was having this striae of Retzius, right? So it will bulge slightly, the line will show a slight bulging on the outer surface. Okay, this slight bulging, it appears as this. You might be able to see these transverse. Sorry, and these transverse groove like structures, okay, these wave like structures. So this is called perikymata. It is just how the striae of Retizus represent itself on the outer surface of enamel. There are 30 perikymata per millimeter in the region of cemento-enamel junction. So over here in the cervical region, there will be 30 perikymata per millimeter, but it decreases to 10 per millimeter in the incisal and the occlusal region. So over here it will be decreased and it will be around 10 per millimeter. Cracks. What are cracks? Okay. So cracks are fissure-like structures. They are present on the outer edge of enamel. They are the outer edge of enamel lamella, and they are present at right angles to dentino-enamel junction. Okay. So these are basically cracks are gaps in the enamel, and they are present on the outer edge. Okay. They're present on the outer edge, and they are present at right angles to dentino-enamel junction. So if this is a dentino-enamel junction, they'll always be perpendicular to the DEJ. Rod ends. They are concave and vary in depth and shape. They are shallowest in the cervical region and deepest in the occlusal region. So if this is a tooth and my rod is ending over here, so it will end kind of like this in this shape. Okay, it will show a concavity. So this concavity appears kind of like a pit in the microstructure. So let's just say that this appears like a very shallow rodent, and this is a very deep rodent. So the deep ones will be present in the incisal region, and the shallow ones they will be present in the cervical region. Okay. Now neonatal lines. Just a second. Just give me some time to clear this up. Okay, so what are neonatal lines? Neonatal lines, it is a line that demarcates the prenatal and the postnatal enamel. Okay, so there is some enamel that is formed before birth. This is called the prenatal enamel, and then there is some enamel which will be formed after birth. So this is the postnatal enamel. Uh, this is prenatal, and there is a difference. This line which demarcates them, this line you can see over here, the dark brown line, it is called the neonatal line. So why is there a difference between the prenatal and the postnatal enamel? Is because when the baby is in the womb, the enamel formed is of higher quality, and it is of higher quality because every all the nutrients are supplied, and it is the fetus is a very well protected environment. So this high quality enamel is formed, prenatal enamel. But after the baby is formed, there is a compromise on nutrition, and it is not that well protected, so a lower quality enamel is formed. Okay, and this line, the neonatal line, it demarcates the area between them. Okay, so it distinguishes the prenatal and the postnatal enamel. It appears as an accentuated line of Retizus, so it is brownish in color and it appears like a line of Retizus. The difference in the quality of prenatal and postnatal enamel is due to abrupt change in the environment and nutrition of newborn infant. So I already explained that to you. The prenatal enamel is usually better developed than the postnatal enamel because the fetus grows well in protected environment. I already told you that. With an adequate supply of all the essential materials. So there is no compromise of nutrition when the fetus is inside the womb. Most frequently, this line is absent in the first molar of boys than girls, indicating that the girls are more dentally mature. So it is generally absent in the first molar of boys. Okay, this line is generally absent. Now, surface ultrastructures. What are other surface ultrastructures of the enamel? There are pit, enamel caps, and enamel brush. What are pits? These are tiny depressions of 1 to 1.5 micrometer in diameters. They represent the end of ameloblast. Okay, so if a tooth was being formed, okay, and then towards the end there was this ameloblast, and it was over here. So this convexity that stayed in the on the outer surface of the tooth, this formed pit. Okay, what are enamel caps? So enamel caps, remember, these are elevations. Okay, these are not depressions. You can correct. You have to correct this in your notes as well. So it is elevation of about 10 to 15 micrometer in diameter. It is due to enamel deposition on non-mineralizable debris. So if I continued so there is a bulge over here, and there's some organic material, and I continued in enamel deposition over this. So this will cause enamel cap. Okay, and enamel brush, there are larger enamel elevations. So they are basically bigger enamel caps. Okay. Now coming to Hunter Schreger bands. What are Hunter Schreger bands? Um, Actually, I'll continue from Hunter Schreger bands in the next video. We have Hunter Schreger band, nard enamel, and enamel cuticle, enamel pellicle. So I'll take all of this in the next video.